The reason why we've come out to that is that we're going to have to go down to Durban. Of course, the Premier of KwaZulu-Natal, that's Premier Sihle Zikalala, is expected to address a media briefing on the latest developments of COVID-19 in the province. Let's go there right now.
The latest.
Thank you, Mr. Mabaso, MEC, Nomagugu, Smelane Zulu, members of the media. We would like to take this opportunity to greet all of you and thank to be with you today and interacting with you a day when the world is focusing on the work of journalism and journalists as a whole. And I'm sure you are proud that South Africa is rated amongst the best in terms of media freedom, in terms of access. The fact that we are rated number 3 in Africa and I think number 31 in the world is a reason for celebration, especially on your side. This week, we commemorated the International Nurses Day, which we use to pay homage to the role that is played by nurses in the fight against COVID-19. Once again, we salute our valued nurses and we wish to assure them of our continued unwavering support as we continue to implement strategies to defeat the coronavirus. Equally, we extend our appreciation to health practitioners across the board for their continued involvement and efforts in waging the war against COVID-19. With regard to the issue of transmission from level 4 to level 3, we meet here at a time when we are preparing for a transition from level 4 to level 3 of the national lockdown as announced by His Excellency President Cyril Ramaphosa last week. Our focus today will be to unpack the latest trends and development with regard to this pandemic, but we will also share with you the KZN integrated response plan as we prepare to move to level 3. Just to refresh our memories, KwaZulu-Natal was the first to report a COVID-19 case in the country. Patient 0 was identified on the 5th of March 2020. Since then, the province's COVID-19 comprehensive response plan has sprung into action in a remarkable way. The province has seen a rise in the number of cases and deaths in the ensuing week, and we had to embark on an extraordinary measures to raise the awareness of our people about this disease. We hit the ground running in readying our staff and healthcare facilities to manage the situation. There was a period when the province reported a death rate of 2 people a day, and it led all provinces with regard to the number of deaths in the country. We can now report that there are days where we report no death at all. This makes us think and feel that we are making a positive impact with the programs we have put in place to fight COVID-19. In terms of assessing the impact of the lockdown, since the lockdown was announced and implemented, we saw the plateauing of the curve and then the steady decline in the number of new cases and the number of deaths. It must be remembered that we are a province that attracts more tourists. Hence, at the beginning, most of our cases were imported cases. We can attest to the fact that lockdown has worked for us in KwaZulu-Natal. We have been able to prevent a possible catastrophe in which thousands of people could have died. The lockdown has lowered the infection rate and provided us enough time to build capacity and the capability to mitigate the impact of this pandemic. In terms of the capacity created thus far, in just a few weeks or few months, KwaZulu-Natal has implemented a successful mass screening and testing program that has yielded positive results, and such results are as follows. 1. More than 2.4 million have been screened for COVID-19. More than 59,000 people have been tested. 1,498 confirmed positive cases. 806 recoveries. Now, if you look on that, the percentage is about 60% of recoveries. So it means that there is work that is being done. Sadly, we have lost 45 people as the province. With our bed occupancy in ICU sitting at 1.1 of the available ICU beds, the number of recoveries is increasing, and we're pleased to see this trend. We have managed to prepare more than 6,400 beds for isolation, quarantine, high care, and ICU throughout the province, with each and every district well represented in this regard. So our capacity to accommodate patients has increased, and I think we are now confident that we are not going to be overwhelmed by this pandemic. Last week, when we spoke here, we had 608 people who had recovered. We had 38 patients in private facilities and 64 in public. We had 40 deaths. This week, the number of recoveries stand at 806. Those recoveries give us hope that indeed COVID-19 can be defeated. That being said, we continue to see an incline in terms of positive cases, but it is comforting that the number of recoveries is also rising. We are working extremely hard to defeat and decrease the number of active cases. So each and every time we see